Hello, I'm Gemma, and for this project, I decided to interview a lovely lady named Lauren, who is 31. The setting of our interview was at a local cafe. I wanted to do this to ensure that it was a comfortable and welcoming environment for both her and myself to conduct this interview. Along with the setting of being in a cafe, I decided to choose a cafe that we could have a booth situation at the back of the cafe, obviously to provide some privacy for Lauren herself when answering some personal questions to not be overheard by others in the cafe. The purpose of the paper, well, in this case, the video, was to analyze my ability to interview a woman in a uncomfortable type scenario. So asking them awkward and uncomfortable questions about their health and well-being, and analyzing my ability to do that, but also to comprehend with the answers. My previous role was in actually recruitment, so I have conducted a lot of interviews in a corporate setting. So my ability to conduct and run an interview I would feel is very high from previous experience. However, for this particular interview, it's obviously a lot different to a job interview. So we're talking about intimate details of their life and possible awkward situations that we might encounter. So my thoughts and feelings around that particular case is that I can conduct a general interview, but conducting it in this kind of setting is a lot different. I thought I did quite well in this. I personally am a very open human and like to talk about all things gruesome and gory and personal. So I think I was pretty comfortable with that particular situation for the interview. As said, my thoughts and feelings around this interview was I thought I conducted myself very well. Looking back at the video evidence of the interview, there was a few occasions and questions that popped up that I could tell within myself I became quite awkward. Talking about weight, for some reason, my body language was a bit withdrawn. I don't know why this is the case, but obviously something that I need to improve on. I think possibly because weight can be an awkward topic to talk about. People don't like talking about their weight, especially women, especially if they've had previous weight issues, especially in their teens, which is a vital time in one's life. I also think that I could have elaborated a bit more on responses that were given. For example, when talking about mental health, Lauren just kind of said, yep, it's all fine, and skimmed over that. And I proceeded just to go into the next question. Mental health is an important topic to talk about. So I think personally, from my point of view, my body language as well as my ability to elaborate on the responses needs to improve around those particular awkward questions. It allows the interviewee to be more comfortable and allows them also to realize that I'm engaged to make them realize that they can elaborate if they would like to instead of just giving shorter answers. We're now going to look at the so what. So describing the theories around it and the knowledge that's gained. So now we explore the so what the previous knowledge of communication and theories that supported my actions. So my previous knowledge around interviewing, as I mentioned, is quite high. But in terms of theories, I looked upon using the closed and open questions as stated by Stein Barberry in the 2013 book he wrote. So I had a range of closed and open questions. Now, what I mean by that is a closed question is when you're looking for just a one-worded, very short answer. And an open question is more looking at evaluation and elaborate answers. For example, asking her age is a closed question. It's a one-worded answer, 31 in this case. An example of an open-ended question was describe how you would state your overall health. So this allowed her to answer in a more in-depth evaluation using sentences. So with using this theory, it allowed me to gain information quickly and honestly through the use of close, and more elaborate answers through the use of open questions. The theory, as stated by Grigg in 2006, is the use of timing of the questions, which is super important, especially in the world of midwifery. For example, in the booking appointment, you need to time the questions accordingly to make the woman feel comfortable. So, for example, I timed my question of sexual health towards the end of the interview, which allowed Lauren to feel a bit more comfortable in answering that question. And although not getting the answer I quite wanted, because it was a very short answer, it still was a good use of timing to allow her to open up further down the line, talking about mental health and what. Further prior knowledge is the use of interpersonal skills. So this is to allow me to develop the rapport and a relationship with Lauren. As stated by Brodat et al. In 2014, it allows equality, trust, and involvement. With the use of authenticity and positive attention and empathy, it results in that involvement of the interviewee and the ability to feel comfortable within the interview. I believe that my interpersonal skills are quite high. This is just from previous experience and knowledge around what is required. So I'm going to look into some different things that I could have used, alternative strategies. So one particular theory that was stated by Loftus and Mackett in 2008 was the utilization of interview phases. So I believe in my interview I did not follow this, which I definitely could have done better. For example, the introduction phase. I definitely could have utilized this in introducing myself, what I was there for, what the purpose of the interview was. Instead, I kind of just went in blindsided for Lauren, which meant that resulted in her not knowing what was coming, not knowing that there was awkward questions that were arising throughout the interview. Furthermore, it was the termination phase that I did not utilize. So ending the interview in a way that further made her feel comfortable and understanding of the purpose. Also, just to summarize the answers, to allow her to elaborate if she would like. I did ask her at the end, do you have any questions around what was asked, or do you want to add anything? However, I think I could have done that in a better way to allow her to feel comfortable to add on. Instead of just brushing over it, just having a casual conversation around it to better close off the interview. In terms of a reflection on the impact of social and cultural diversity, for me, it wasn't too much of a concern. In her background, Lauren's background is she's Australian, white, blonde hair. So we are very similar in that respect. So diversity was, excuse me. Now we look at the now what in this reflection process. So throughout this video, we've talked about the Driscoll's what model, which is the what, so what, and now what. So we're up to the now what, and this is describing the new understandings that have been gained from this reflection. So in line with the midwifery standards, we're looking at, for instance, standard 2, which is engaging in professional relationships. So we have to practice ethically with respect to privacy. So in this situation, something that definitely could have been improved on was the privacy of the interview. So next time I would probably do it in a park or somewhere with not as many people around. Probably would have made Lauren feel a bit more comfortable. Also, in terms of this standard number 2 is to make a clear difference of personal and professional relationship. I think I did that pretty well with Lauren. Obviously, it helps having your uniform on. It makes it more professional. In terms of being professional as well, we now look at the now what of reflection. So in line with the midwifery standards, let's look at standard number 2. So engage in professional relationships. we really need to make sure that we practice ethically and with respect to privacy. So obviously in midwifery, we'll be in a hospital environment or for group practice, maybe a home environment. So it's very private. In a hospital environment, you can pull the curtain around or you can be in a separate room. For this particular interview, I definitely could have improved on this. We were in a busy cafe, so privacy was a bit of an issue. Probably would have done it in a park. Providing weather was good, with not as many people around. This would have made Lauren feel a lot more comfortable in answering and elaborating on difficult and awkward questions. Furthermore, another midwifery standard is standard number 4, the use of comprehensive assessments. So using the answers from the interview to determine the health and well-being of the patient, or in this case, Lauren, and factors of that to help make a plan for the future. So, for instance, in this case, when we're talking about Lauren's epilepsy, and she said that she struggled figuring out a different medication that worked. She said that she's on one now, but that could change. Our bodies are different. So making sure that we have an understanding around that to determine a plan and assessment for the future in case this medication for some reason stops working, or in the case of falling pregnant, in case it has a negative reaction to that as well. So as we can see throughout this process, we've used Driscoll's WHAT model, the what, so what, and now what for reflection. It's a good way to reflect on your abilities and your practice. Furthermore, by Andre, Kate, and Hartfield in 2011, they looked at the use of reflective practice. And what stood out for me in that, in their paper, was how others perceived the situation. So looking at how Lauren perceived what occurred, the reflection from that was through the feedback she gave, which was very good. One thing that she did say was not so good was my posture. Definitely could improve on that. So posture is definitely a thing that makes people feel comfortable in a situation. However, all the other feedback was very good. She enjoyed the experience overall. She thought it was very informative. So that's how she perceived it. Kate, and Hartfield also mentioned in their reflective practice how I perceived the situation. So I think I perceived it quite well. I think I did overall really good for my first time, asking awkward questions to someone that I don't know. I'm very comfortable with people I know, asking questions, talking about it, all that, but it's very different asking a stranger, essentially. So reflecting on that and making sure that I understand where I can improve and what I did well to continue doing that. Overall, this process was really good. It allowed me to understand how to build rapport and make people feel comfortable in what could be a very awkward situation. That was obviously the use of the interview. The use of the reflective practice is also very informative. It allows me to understand what went well, what didn't go so well, and what actions can be taken to improve. Thank you very much for listening.